It's Ruth Armstrong from Croaky here, and I'm with Salima Dr. Olataga-Alofivae Doorbinia, who is at the CPHCE forum today, where she's received a research prize for some research she's been doing with them and in her practice. So I just thought we might talk a bit about the project you've been doing and where you come from.
Oh, thank you. Thank you very much, Dr. Armstrong. Thank you. What a pleasure to be here today to receive this honour. A little bit about myself. I'm a New Zealand trained graduate back in 1990 and then came to Australia back in 91, met my love of my life and settled. I think it's very important to talk about this award in terms of what it means. I think it's a recognition of the work that our practice has been doing since 1995 when we first set it up. And Professor Mark Harris was, I think, one of the original professors where I trained in Fairfield GP Division. I think it's still called that today. And he really imparted into me the importance of knowing quality healthcare and what it means. So over the years, in our own small general practice, we've had the opportunity and the honour to be involved with a lot of the university projects, as he mentioned when he gave us the award. So I take this award in recognition of the work that our whole practice has done and the leadership that I've been able to have to lead it and to bring about good data. As a result of that, I'm now really excited about the things that we can achieve as general practitioners, that we are excellent and effective communicators. I think it's very important that we take on board the role of leadership that we have. And in our community, it means being able to drive projects that will improve the quality of care. They're at all different levels. They can be projects about communication, research projects about assessing a new app, projects to assess what makes a good way to deal with certain types of populations. So it's really, really effective. The things that I have learned is that we GPs need to get on board and really do need to value the importance of research. Why? Because I think it will determine some of the important outlooks that we can have. Some of the barriers to research for GPs might be time and the fact that they may not be interested in it. So I think probably what our professors need to do is probably when they bring their medical students or when we train our registrars to really try and emphasise to the GP principals and to the GP supervisors why it's important to take part. It's for the future. We ourselves, I have a daughter who's currently in 5th year, who's training in completing her undergraduate degree in medicine, but I hope to impart on her the importance of research. She's going to go through a new world where research is just part of the academia. But I think those of us who've been in general practice for more than 23 years now, for us, it's important that we try to pick up and value it. So for some of us, it means learning new skills. For some of us that really do know the skills but just for some reason are not interested, we need to try and impart that interest. So I think that's what I'd like to do through our work, through our future work, is to really bring out that it's not that hard. It just depends on having an interest, having a burning question, and it means then that when you see your patients, that we start to see patterns of diseases and then try and understand or wonder why can we not help that population any better. So for myself, my passion is diabetes and all the issues that it has and how it affects a lot of our populations in the area where I work, which is southwest Sydney. So the populations are there, Aboriginal health, Pacific Island, especially Samoan, as I am Samoan by descent, and a lot of our other called populations such as our Vietnamese, our Lebanese. So I do take those challenges, or when the universities ask for practice to take part in their research projects to get on board. But I would also like to be involved in maybe initiating or writing up a research project. So another thing I've taken up, hopefully in the next 12 months or so, is to take on a little bit more learning and studying about how to acquire acquire more skills in good research, so that we can then ask really good questions about it.
It's great to see a GP getting an award for research in your own practice. It's fantastic. Just finally, it was an interesting forum today. What were some take-homes for your work?
Well, it was really interesting. I did write some notes. I think for me, it's to raise the awareness, so it's not just the doctor-patient scenario. It's looking at the bigger picture now, and it's looking at aspects from patient's perspective, the doctor, which might be a GP or specialist, to the organisation, which is the hospital, the PHNs, and then in terms of the government, what they're doing. I think it's going to be an absolute learning curve, because now that you have that much broader approach, I won't be just looking at my own doctor-patient relationship. I'll be looking at the wider community. I love the speakers, the academics, such humble people, and they do a lot for our services. I think we do need to network more. I'd like to see them try to get to the big practices, so the big primaries, the big, the ones that hold all the fun, they hold a lot of doctors, and they take a lot of power too. So the GPs in those areas sometimes can't put their hands up and say, I'm interested in that, because of whatever work structures they've got. So it'd be really worthwhile if we could get brave doctors to come out of those structures and take on research projects.
Yes, how amazing if we could get some of those big groups involved.
Yes.
Yeah. Thank you so much, Olataga.
Thank you for the opportunity.
Okay.